Upside on Channel Africa. Let's get into our first conversation of the afternoon. We are talking hair, and joining us right now is a lady who is a doctor and a surgeon specializing in direct hair implantation. Dr Kiéra Moodley is joining us to chat everything DHI and how it differs from the other procedures. Dr Kiéra Moodley, welcome to the Upside.
Kiéra, baby, I think you should unmute so we can hear your gorgeous voice that matches your face, baby.
Young and yes,
perfection.
Welcome to the Upside.
Hi.
So good.
Thank you for having me.
So good to be chatting to you, Doc, because we want the details on this because there's so much conversation around hairlines, how to restore them, where to go to restore them. People are in Turkey, some are here. Can you give us the 101 on the difference between DHI and FUE? What are we talking when we're saying direct hair implantation?
So direct hair implantation is a method of hair transplant, but it's also the company's name. What happens is we are by far the most advanced compared to FUE. So with the FUE, the extraction of hair is the same between DHI and FUE. However, the implantation is different. So that's the beauty of DHI. So with DHI implantation, we use a specialized pen, a patented pen, which allows us to implant each individual hair follicle on its own. Whereas with FUE, they make slits in the scalp. So the slits, once they make the slits with a sapphire blade, now you imagine that you're actually, first of all, making a cut into the scalp.
Sure.
The second thing that's happening is that they are pushing your grafts inside the slits. So you should think of it as flowers. Every flower needs its own nutrients. It needs its own blood supply. So if you're now pushing multiple grafts into a slit, it doesn't grow as well. So with DHI, each individual hair is implanted into its own pocket, which allows for growth. The other issue is that there's technicians that usually work with FUE transplants versus DHI. It's a doctor that does it from start to finish. You would imagine that if there's more than one person working on your hair, that can cause a problem because you could never get a symmetrical transplant. So when you come to DHI, you're not just coming for the method of transplantation, you're also coming for the international standards, safety protocols, and guidance from our international partners.
I wish we spoke more about the confidence that is affected by hair related issues, right? Because the one thing that I also want to know is the lifestyle aspect of it. You know, what are some of the common reasons why we experience hair loss, you know, to the degree that someone has to get a hair transplant? And I'm talking both male and females.
So by far the most common cause of hair loss that we see in our clinic is something called androgenic alopecia, which is essentially genetically and hormonally driven hair loss in males and females. The vast majority that come to the clinic is actually males, and I think it's just because women are usually slower to seek help.
That feels like an oxymoron though. Because a lot of the girls are the ones that usually act, you know, quickly when medical issues come up. So the fact that it's women who are acting slower, is it because we have, you know, easier alternatives, the likes of wigs, sew-ins? You know, what do you think is the reason why we have a slow upkeep in women coming to, you know, kind of handle their hair issues?
I think women believe that, first of all, it's a different pattern of hair loss that happens. So in men, it's much more noticeable earlier on when treatments are still available. So you'll notice you'll see the early receding hairline, whereas with women, you become diffusely thin. So it's a slower process that happens. And I think women realize when it's far too late. And with women, they also, I mean, you know, we can cover it up, and we're usually good at that with some of the powders and fibers, and we style our hair in different ways. So I think that also delays treatment.
So maybe let's chat about wigs and weaves, because I find it so interesting that in some ways wigs and weaves are protective hairstyles in terms of just popping one on and not doing anything to your hair. But how does, you know, wigs and weaves, how do they damage your hair and the follicle? I don't understand that part. And how do you then repair it at DHI?
So it depends. So your hair follicles is what determines whether your hair can regrow. So with weaves and braids, especially tight braids, what happens is that there's this constant pulling action on the follicle. And eventually, if it's over a prolonged period of time, it can actually pull the follicle out of the scalp completely. So once the follicle's out of the scalp completely, unfortunately, the only option for you is a hair transplant at that point. If there's follicles that are still there, we can regenerate it. But if it's prolonged and very tight, it will pull out the follicle completely.
And is it true that with particular black people's hair, because it's so curly, that when it comes out of the scalp, it comes out at a different angle as opposed to our other counterparts where it comes out straight? Is that also a challenge in terms of, getting the hair follicle out of the scalp? Is that a thing that you see?
That is definitely a challenge that we have. It's a very common problem that happens because Afro hair actually curls inside the follicle. So it does make extraction in particular, not so much implantation, does make the extraction more challenging. At DHI South Africa, we have a specialized extraction machine, which actually allows us to perform these procedures with a much lower transection rate. Transection just meaning when we take the follicles out, we get the whole follicle rather than cutting it off, which tends to happen a lot in Afro transplants.
Let's talk about the men quickly, just to kind of solidify this conversation. I want to understand what happens to the confidence of men when they experience, things like balding, patching in their hair. As much as we speak about how us and our makeup, are just this eccentric thing, but I feel like with men, their hair is their makeup. Even when they get a bad haircut, you can kind of see it knock their confidence. Let's talk about, the psychological aspect of the work that you guys do with hair transplants and restoring the confidence in men as well.
It's honestly, it's actually such an amazing field to be in and to see, because the amazing thing with hair transplants is that you don't have immediate results, but post a transplant, people start to have an idea of what their hairline would look like. And I mean, I've had patients that cry afterwards because it's something that, you want to do for such a long time. And I mean, if you have a hair transplant, it means that you've waited a long time to get it done. So it's really beautiful. And I think that more people need to realize that investing in yourself is something just so important, and we shouldn't neglect ourselves, especially men.
Thank you so much.
I know women are quick too.
Thank you so much for joining us on The Upside, Dr. Kiéra Moodley, who is a specialized surgeon in direct hair implantation at DHI South Africa, chatting all things DHI. It's actually so fascinating, the technology that is coming out for, babe. Why not? Thank you to Kiéra and her team doing amazing work, doing the Lord's work. Speaking of the Lord's work, it's 3:30. Zycon's got your sport.